10 treatments for sleep apnea. 1. Lifestyle changes. If you have a mild case of sleep apnea, you may not need medical treatment. Simple lifestyle changes can do the trick. It might seem difficult at first to change everyday habits like reducing your smoking and eating healthier foods. However, your physician can explain the benefits of making these decisions. Even if you try to quit and succumb to temptation, you should never give up. 2. Continuous positive airway pressure (CPAP). This method deals with the application of a breathing machine. Patients with moderate to severe sleep apnea wear a mask over the nose, which delivers air pressure during sleep. It produces just enough air to keep your airway passage open because the pressure is slightly greater than the surrounding air. 3. Bilevel positive airway pressure (BiPAP). If you want to stick with something similar to CPAP, but it is not helping, there are still options. Your doctor might recommend C-Flex with CPAP, which is a good choice if you need a little pressure relief. 4. Expiratory positive airway pressure (EPAP). If you suffer from mild obstructive sleep apnea, an EPAP is a treatment that will not only reduce snoring but also help with daytime drowsiness. Wearing an EPAP mask as a breathing treatment is not for everyone, so talk to your doctor about other options. 5. Adaptive Servo-Ventilation (ASV). If you are looking for a more scientific way to treat sleep apnea, you should ask your physician about ASV. This innovative airflow device allows the machine to learn your breath patterns and store the information in the built-in computer. During sleep, ASV will utilize the information to normalize the pressure of your breathing and prevent pauses. 6. Oral appliances. Besides wearing a mask, patients with sleep apnea can use an oral appliance to ensure the throat will stay open during sleep. Not only will you have to discuss the treatment with your physician, but you need to talk to your dentist. Just like the mask, you might have to go through a trial and error process until you find the ideal fit. You can schedule regular follow-ups for at least a year to assess your symptoms. 7. Tissue removal. If all of the non-surgical treatments for sleep apnea failed after 3 months of experimenting, you could consider surgery. This medical procedure removes tissues from the rear of the mouth and top of the throat. The surgeon also removes both of your tonsils and adenoids. This method is less efficient than wearing a CPAP mask, but it is successful in stopping vibrations from throat structures, which is a direct cause of snoring. 8. Jaw repositioning and implants. The jaw plays a factor in developing sleeping disorders and breathing problems. This surgical procedure moves the jaw forward away from the facial bones. Jaw repositioning can be beneficial if you suffer from symptoms of sleep apnea. Plastic rods referred to as implants are surgically embedded into your soft palate. Both procedures must be discussed with your doctor and planned out carefully. 9. Creating a new airway. Medically known as tracheostomy, creating a new passageway is a serious surgery. If you suffer from severe sleep apnea, then chances are good you have already tried CPAP masks, BiPAP, oral appliances, and are still victim to sleep apnea complications. If you're considering such a dramatic procedure, it's because you've probably tried other surgeries to no avail. However, if you have life-threatening sleep apnea, the problem will persist and tracheostomy might be the last resort. A surgeon will insert a tube through your neck, which will allow you to breathe and live. 10. Other surgeries. Just as you can make lifestyle changes to help combat sleep apnea, the more you target health problems, the better you can simultaneously correct the sleeping disorder. Therefore, if you optimize therapy for heart failure, you can equally eliminate sleep apnea. Thanks for watching. Like this video. Share and comments, subscribe now for new videos and update.